Hi, I'm Dr. Sushila from Indraprastha Apollo Hospitals, New Delhi. Today I'm going to talk about the importance of the history and physical examination sheet filled at the time of admission by doctors. It is said that over 80% of diagnosis can be made by history alone, a further 5 to 10% on examination, and the remainder on investigation. Whether this is true or not may be open to debate, but it is clear that history and examination skills remain at the very core of clinical practice. At the beginning, the importance of a structured history and physical exam sheet that records all information as well as acts as a checklist so that all relevant points are addressed needs to be emphasized. Every part of this document, be it source, allergies, height and weight, presenting symptoms, past or family or socioeconomic history, vitals, general and systemic exam, other assessments, will eventually aid in the accurate diagnosis and appropriate plan of care for our patients. I would also like to stress on medication reconciliation and discharge planning, as they are a key to ensuring that continuity of care is assured for the safety of our patients. Here are a few helpful tips as you move to your next patient for taking their history. Glance through the available medical records before seeing the patient. Patients expect you to read their records before you meet them. Your manner, your physical position with regards to the patients, and your body language all contribute to the outcome of the consultation. Ask open questions and avoid leading questions. Use gentle steering phrases to stay focused. For example, "That sounds tough. Tell me which one of these problems is troubling you most." Perhaps we can come back to that. Tell me a little bit more about the shortness of breath. Use a good bedside technique while examining patients. Ensure that privacy is maintained at all times. Just remember one thing: whether the patient is a patient in real life or a patient in an exam, they are a human being, a person. At some point, they'll be you. Document clearly, accurately, and completely. Remember that this document will first and foremost communicate with your colleagues and other staff. However, it is also very important for insurance, court purposes, medico-legal requirements, etc. In conclusion, ask yourself, why did this patient come? There may be hidden anxiety, such as a concern about cancer, that needs to be explored and addressed. Patients sometimes begin with, "I hope I'm not wasting your time." This may mean, "I feel I'm wasting your time and this is not serious, but I'm worried." If the patient was initially anxious but finally reassured, the doctor's time was not wasted. Remember, good history taking and examination is a great art and skill. It is an opportunity to explore the patient's needs and expectations and to educate. It not only aids right diagnosis and treatment, but builds your rapport and relationship with the patient.